How do you, as visionaries and founders, truly be able to navigate the thrilling yet daunting path of creating a solution that truly make a difference in the healthcare space, yet be able to make sure it thrives and become a market leader on a grand scale?
Welcome to Provider's Edge, the podcast that helps healthcare entrepreneurs and innovators break down barriers and control their business, life, and future with valuable action steps. With me, your host, Sabrina Runbeck, a recovered clinician and a business deal catalyst. Let's rewrite the rules and create a positive social impact while increasing your profitability. Welcome back, everyone. This is your host, Sabrina. And today we have the lovely Jessica Bell Vanderwall here. She is framing the path to parenthood as the CEO and co-founder of Frame, a venture inspired by her own challenging family building journey. Prior to Frame, she has been leading team in growth, customer success, and strategy at various early and late stage companies, including Castlelight Health, Nike, Deloitte Consultant, and Genentech. She currently sits on the advisory board of multiple digital health companies, and she has her own ventures, which is very fun to have. Educational institution, nonprofit, and women's empowerment organizations. Jessica foundationally training in public health and international volunteering experiences colors her passion for healthcare solutions on a broad scale. Jessica holds a BA in public health from UNC Chapel Hill and an MBA from Harvard Business School. Thanks, Jessica, for being here with us.
Wonderful. Great to be here.
And we wanted to champion Jessica, give her the major shout out. We are partnering up with Postpoint Pass to feature their 6 Impact Award winners for their digital technology and health tech solutions. And Jessica's company Frame is one of them. So congratulations for all the rounds of interviews and process that you went through to get that award. Yay! How did you actually found out about the award and then thinking about, hey, you know what? It's a great opportunity to take and then let's go for it.
Yeah. It's a fantastic group of female and some male leaders in the women's health space. And in particular, Bethany Corbin is someone I know and really admire in the femtech women's health space. And she mentioned the award and I immediately looked at it and saw how much of an impact it would make for us in helping to bring the Frame story to the surface. So it was a friend of a friend and a LinkedIn post that led me here.
That's awesome. I love for her to say that no matter what, a lot of ideas come from that word of mouth. And
absolutely.
Another time is that we have to take up the opportunity because anyone can see the LinkedIn post, can see a recommendation and not do anything about it, but you did something about it and you truly see yourself and your company in the frame of we deserve the spotlight. People do need to know about us and let's do something.
Absolutely.
So when you're thinking about the solution that you bring into the healthcare space and women's health space, what do you see is the major challenge and how you guys are uniquely positioned to solve it?
Yeah, it's fascinating. I know you gave a bit of a overview of my background, but I've worked in healthcare my entire career, as has my co-founder. But what really led us to build Frame was the intersection of that healthcare experience and our own personal infertility journey. And unfortunately, for those of you out there that may have gone through infertility or some sort of challenge in the kind of family building process, that it is not a linear journey. There are a lot of twists, a lot of turns, a lot of things that you are really unprepared and not expecting. And for someone like me, like us, that have worked in healthcare for so long, we were shocked with how overwhelming the journey was, but also how many things we learned about in a reactive way. And so in particular, I have a variety of different chronic conditions and issues that would impact my fertility. And I only found out about them once I went down the path of, the standard try for 12 months. And if it doesn't work, come back. And so it was really shocking to me that I wasn't armed with that information before. And more importantly, that then I was left with very little options other than to go through a really intensive round of fertility treatment that is very costly, very invasive, and it really weighs on you, I'd say emotionally in particular. And so after that journey, very honestly, we were on the other side of it, very lucky to have a child, I felt really strongly that this problem wasn't going to fix itself. Healthcare is often quite reactive as it is, but on this journey, when you have something in mind, a goal that you want to achieve, sometimes years, decades, overall in advance, you should be able to understand some of those factors earlier. And so myself and my co-founder both come from the business side of healthcare, and we teamed up with a group of clinicians, OBGYNs, reproductive endocrinologists, to build what is now Frame. And our whole thesis is, how do we help to unearth fertility-related risk factors earlier in the journey? And let's not mistake the fact that these also impact maternity. So they're going to impact the pregnancy journey at some point too. So we really do need to care about them in advance. But how do we unearth them? How do we support people? And how do we get them onto the right path with kind of a full village around them supporting their next steps? And so that's really what we are aiming to do at Frame. Proactively surface fertility and maternity related risk factors, get people on the right path, and ultimately lead to better outcomes for everyone involved, but especially the patient or the couple.
Yes, when we're thinking about the whole entire journey, yes, a lot is on the moms, but it's really the whole couple, and
Absolutely.
sometimes it's the whole family, right? Like everyone wanted to be there supporting, and it's sometimes the tough thing is not even just the couple, it's how they feel like they're being perceived by their family members, and then the encouragement or discouragement of constantly trying and where you actually headed into the space. So so many different parts of that, bringing a baby into the world, bringing addition of someone is part of you. And for some people, for having a family is part of their identity. And it's truly what makes them fulfill in life. And so for you, it's not just solving the problem of fertility. It's actually about who they are. How do we create lives, beings, our purpose in life? And some people's highest purpose are being able to support their family members, and not like some of us who really wanted to drive, right? I know my highest purpose is not having to have my own child, but I see every single technology innovators. That's what I wanted to empower, because I see those as the little children in a sense of how do we make sure they grow into someone who's a leader, right? And so all of us have a different way of see our purpose. And for you guys, is such a connected body into the parents and be able to solve things much earlier on and without having through all those struggles. And what's the development phase now? Like how has you gone through? I know every venture has these milestones. And so tell us some of the success journey that you have experienced so far.
Yeah, it's a great question. And I just want to go backwards slightly on one thing you said, just because I think it is important to call out that, as many of you may know, but many of you may not know, a third of the time it is a female related challenge that results in infertility. A third of the time it is a male related component, and a third of the time it is unknown or potentially a combination. And so to your comment, it's not just a women's health issue. It is a broader issue and often a window into the overall health of the individual and or couple. So anyway, I just had to take a moment on that. But to your comment on the journey, I mean, like a lot of you that may have started your own business, there are twists, there are turns, there are things that you're not expecting. And I'd say for us, we started out really wanting to understand two pieces of this problem. One was the patient experience. And so we spent a lot of time in the early days interviewing patients, couples of all walks of life to understand the family building process and what their goals were and what their challenges were. But the flip of it was, what's happening today that isn't filling this need? And so we also spent a lot of time, obviously, because this was built in partnership with clinicians, next to clinicians. And, I think a couple of things came to the surface, which has ultimately led to our business model today and led us to actually partnering alongside clinicians. And that is, when we talked to clinicians, a lot of what we heard was the challenge here is that we don't get a lot of time with patients. There's not as much time to dig into some of these topics. Oftentimes, we're waiting for patients to bring up these topics and make sure that they're something that they care about. And additionally, as we look at the data, 63% of doctors are struggling to meet the demand, especially as there's more asks of their time. And so fitting these detailed conversations into the clinical workflow was just really hard. And so really the journey we've been on at Frame has been so fantastic, because while we started thinking about what is the patient-facing experience, what we quickly learned is the way to drive success is by complementing and extending the care of other clinicians. And so I'd say the biggest milestone that we have achieved over the last couple of years is really going towards and partnering with healthcare providers to bring this to patients. And we have now been partnering with OBGYNs, internal medicine, and fertility clinic providers across the country to bring this product to patients. And that has really unlocked patient acquisition, but also growth as well as outcomes. Because we also know that when you want a child, you can't do that in a virtual care environment, which is what we've built. You need in-person care as well. So it is a partnership. It is a collaboration. And we've been so thrilled to be the first collaborative care model in fertility and family building. And we're just getting started. There's other places for us to grow and complement and support clinicians throughout the patient journey.
Yes, and we all know we have to start somewhere with the intentionality so we can scale from there. Because in healthcare, there's so many pieces we can all tap into to be able to grow. And then especially fertility is a big topic. And when you guys be able to see this so clearly, okay, let's support from a telehealth standpoint first, connect with our physician partners.
Right.
And so then their patient would understand the earlier conversation that need to be taking place, because as we all know, the outwardly spend a patient face to face, we just don't have that much time, right? Like
Right.
there's impossible for us to have that extended conversation and see the right amount of patient to be able to build enough to keep the door open. So it's that toss up of how many patients you can actually serve with a finite amount of time, and you're squeezing all these patients in already. But then we need to thinking larger. What are the support team out there? That's why for any women's health clinic, you're going to have the counselors, you're going to have the nurses, the MAs, the educators, and even some people have mental health supporters, right? And you guys coming in as more of the front end, be able to answer a bunch of questions before they even get into the clinic, and have that closed loop to be better support for everyone. So what's the next direction as you guys are scaling the business, and what are some of the challenges you're able to overcome in this this world of multiple possible options?
Yeah, it's a really good question. And to your comment about bringing different care providers to the table, that is a lot of what we have built. So to your comment, we obviously have clinicians on our team, but we also have folks that have a nutritional and or mental wellness expertise, as well as coaches that can often nudge patients along the journey using live conversations, but also asynchronous forms of communication, which a lot of younger people are going to prefer. And so again, I think to your comment, it's just so essential. And, I think if we look towards the future, what I've been so excited about is, being able to connect the dots on the family building journey. So again, we're working all the way upstream with people that are really focused on primary care as well as OBGYNs. But where we're now feeling this pull is downstream through fertility clinics too, because there's so many pieces of this journey that could be more efficient in a variety of ways and definitely could be streamlined from a patient journey perspective. And so to some degree, to your comment, what I'm excited about is being able to connect all those pieces, bring patients through the entire workflow and then back around once pregnant. But it's also a lot. Like it's a lot of pieces, obviously, to kind of digest at one time. And so, what we've been really deliberate about is co-developing alongside our clinical partners and ensuring that, again, we're thinking about the patient experience, we're thinking about the clinician experience, because what we need to be mindful of is, again, clinicians have their hands full. There's a ton happening. You have so many questions where you're going through the family building journey. The worst thing we could do is put a product into place that actually requires a nurse to log into like one more app or one more place, or direct patients to one more login to get, their instructions. And so we have to be really deliberate. And so again, I think we have a big vision of being able to see this journey end to end. And it's really exciting from a data perspective in the long run. But we have to make sure that we're really zeroing in on each step and make sure we're optimizing and really integrating with the workflow. The other thing that I'll say is, it is not, beyond me, as I mentioned earlier, to think about, well, now where does this go next, right? So if you think about Frame, one of the big things that we're also doing is helping to ensure greater access to care, because we know so many people live in maternity care deserts. I think the last number I saw was, at least around 7-8 million people don't have any access to an OBGYN, and that's unfortunately getting worse. And we're also seeing maternal health outcomes continue to decline in the United States. And so I know that we're already doing a great job identifying risk factors that would be modifiable and impactful to pregnancy. But there's more we can do downstream too. And so if you think about our movement towards maternity, postpartum, et cetera, those are other themes that we're starting to build upon and think about. But again, it's important to make sure that we're really focusing on, are we moving the needle on the outcomes that matter? And what we're hearing so far is yes, and we have to remain focused on those.
Yes. As long as you guys are having that major goal, right? The light at the end of the tunnel, you see it, you continue to work towards it, and then all the puzzle pieces come together. And at the end of the day, no matter who is listening to this, whether you're having a small project management or you're also building your technology solution, or you started with your entrepreneur journey, no matter what, we needed to start thinking from top down. What do I mean by that? What's the highest vision, the goals, the highest level strategy? Where are you heading? Don't get down to the weeds of the doing, right? The more that even you start contacting 100 people, having all this conversation, but if you're not really clear on what do you would love them to help you and do next, then those are time wasted. So every single task, every single activity needed to be super intentional. And Jessica, I love it for you guys to say, we stay on focus. We have all these components. We are bringing solution up front. We have all these experts that can help the family. And then we come at also continue the journey at the end. And we just needed to be on the path and have a clear vision and keep going. Right. And no matter what, at the end of the day, that's what all we can do as a leader in the industry, as a novice who's trying to figure out a solution and not get super overwhelmed. And at the end of the day, we're here to serve. And we're not here to burn ourselves out when we're trying to serve other people, which many healthcare innovators, leaders, and healthcare practitioners tend to do, is pour their soul and heart out and end up being a patient themselves.
Yep.
So we do want to honor everyone who has to contribute in this world, and for you guys to be that special leader in here. So what would be something very helpful as you've been spotlighting with the war? Is there something that you thought about that particularly when you're thinking, hey, media is a great way for us to get message out, but how do you do it in a way that complements who you guys are, and also leveraging media means all these listeners that might not have got in contact with you, what are the some goals that you have as you guys coming out to gain more visibility?
Yeah, it's interesting because we've definitely been behind the scenes. We've been focused as you called out. We've been building. We've been really zeroing in on the outcomes that matter, both for the patients and our partners. And I think to your comment, I am excited to spread the word of obviously what Frame is doing. I'm also really looking to elevate our clinical leaders within Frame because I think it actually is very important that we have more clinicians out there sharing information, sharing evidence-based facts, because there's a lot of misinformation right now about a variety of different topics, and fertility is definitely one of those. And so I think what's important is that we continue to echo that we are zeroed in on evidence-based information. We're zeroed in on supporting and collaborating with physicians and other clinicians and really making sure that they're seen as the touch point for patients in their care journey. And we're here to help and support. We're really that kind of layer behind the scenes that's going to help stitch things together to make it easier for them. But again, we really need clinical leaders also using their voice out there too. And I've been so excited to see our medical director in particular out there, spreading the word of what Frame is doing and saying, startups, digital health companies, traditional healthcare, we have to band together. There's a lot of things we need to move forward and we have to work together on it. The other thing I'll say, and this may not relate exactly to what you're asking, but it was really compelling to me on this award journey. One of the things that you asked us to do is to put a post out there on LinkedIn to just spread the word that we were solving for, the crisis and the issues in the fertility and family building space, and to ask for support. And it was incredible. We put that post out there, and obviously people we knew supported us, but a lot of people that, second, third connections to me or to Frame were also thrilled with what we were doing. And I think it was a great reminder that there's so many people out there that need solutions like ours. And it's important for us to maintain a steady drumbeat publicly. And it really touched us to see people chiming in on a post. And I don't even know how they saw it, saying, so happy you're building this. And that's something that, keeps me going every day, is that we know that there's so many people out there that need support and to not to feel alone. And this process can feel very isolating in so many ways.
Yes, for sure. And I so loving it, because one of the thing I asked back was some of the comments that you guys love the most, right? Mm-hmm. And it's a way for us to say, there's always goodness out there. There's always gratitude. And there's always the way that we attract joy. And everything that we build, no matter if you create something new, right? Something completely different in the industry, we really see the vision we're going for, or something existing. I simply see a better way to do it, and I believe this better way, and that I rather go against the monster of the society or whatever restriction and gonna break through that ceiling, right? So all of us in the journey of growth and development and innovation, we have plenty of support, whether you see it immediately or not. So that was one of the challenge for people, in a good way of challenging you guys to say, spread the word, just put out there. How are you building community? That's one way, right? Social media is one way, but it's also an authentic way to say, hey, can we send out an email? Can we even speak more about it? Because it's not so much just about the award. It's about what it represents, what people believe in you and supporting you. And now you know how wide that possibility can be, and you can even expand from there. And knowing all the support that, despite the people watching or not watching, one of the major thing is what you did make the ask. And when you have that one clear ask, people know exactly how to help you, and they will be able to take action. So I so appreciate for everything that you have been sharing. How can people find out more about what you guys do?
Yeah. So obviously you've heard me mention LinkedIn. So we're quite active there, both myself and our company. You can also find more about Frame in particular at frameyourfuture.com. So those would be the two best ways to find us. You can also find meet_frame, our Instagram account, if you're looking for more user-facing content as well too. So again, we're getting out there. So look forward to meeting many of you listeners out there.
Excited for you. Congratulations for the awards. And then can't wait to see all the amazing things you guys do in the next months and years coming up.
Wonderful. Thank you so much.
Until next time. Bye, guys. Thank you for tuning in to Provider's Edge podcast. We hope you enjoy our latest episode and found the insights and tips helpful. We'd love to hear your feedback on the show and learn what topics you'd like us to cover in the future. So please take a moment to leave us a review on your favorite podcast platform and let us know what you think. Your feedback is essential to help us improve the show and provide you with the content you need to take your healthcare business to the next level. Thank you for your support, and we look forward to hearing from you soon.